Hi guys, sorry I couldn't be there this weekend. We're off on a couple of football recruiting trips for my son, but I wanted to thank each and every one of you for joining us and giving up part of your own personal weekend time this weekend. I know that Randy, Jody, Eric, and Misty have worked tirelessly to bring you a great program, so again, thank you very much for joining us. I wanted to take a brief moment this morning to discuss HD STEM, high density stimulation, and hopefully over the last, say, 6 to 12 months, each and every one of you has heard multiple success stories from us in times where we've utilized HD STEM with great success in your patients. And I think what we need to do is kind of differentiate a little bit between traditional stimulation, conventional STEM if you will, and high density, and exactly what both accomplish, and when we might utilize one over the other. So I guess that maybe one of the simplest ways to framework this discussion is everything that we do in the world of neuromodulation is a function of 1 second of time. And what do we do in that 1 second of time? I think an easy way to illustrate that is if we look at this rectangle, if this rectangle represents 1 second of time, then the industry, everybody in the world of neuromodulation, every single device company, everything out there, for the last 40 years, we have occupied about 1.5 to 3% of time during that 1 second. Another way to say that is, in every 1 second of time, the therapy is actually only on about 1.5 to 3% of the time. And that's sufficient for most patients. As you know, the therapy works, the outcomes are good, patients are happy, and the world moves on. But some smart people a few years ago started looking at this, and they said, hey, there's a whole lot more space that's not being utilized. So what happens if we utilize that? And essentially, that's exactly what HD STEM is. It's simply put, we're just occupying a greater percentage of that 1 second of time. Really, HD STEM can be defined as anything greater than the norm. So anything greater than about 1.5 to 3% could be defined as high density. Real world, what you're seeing is, what we're seeing in your patients is, now we're occupying about 20 to 25% of time in that 1 second. Or again, another way to say that is, the therapy with HD STEM is on for 20 to 25% of each second. So a couple of things. First off, when would we possibly utilize HD STEM over conventional STEM? And we have a couple of triggers, both during the trial process and during and post-implant. If a patient tells us, hey, I'm feeling everything, you're covering my entire area of pain, but I'm not getting enough pain relief, we'll switch them to HD. Or if they say, hey, I feel everything, you're covering everything, and I simply don't like the way that it feels, we'll switch them to HD. And this is part of the uniqueness with high-density stimulation. Because, and it's a little bit counterintuitive, especially for those of us that have been in the field for the last 15 to 20 years. With HD STEM, it's not necessary that the patients feel the stimulation for it to work. And again, I know that's counterintuitive. Compared to conventional stimulation, we know that we're creating a paresthesia, a tingle, a massaging, a vibration type feeling that overrides the pain signal. Well, that's not necessarily mandatory for high density stimulation. We're not exactly sure why that is. We're not exactly sure exactly what mechanism of action that's being utilized right here. But one theory is that the energy delivered in HD STEM is on an order of about 10-fold greater than traditional stimulation. And the way that we calculate that energy is simply frequency or rate times pulse width. So we do know that it's about 10-fold stronger, a minimum of 10-fold stronger than with conventional stimulation parameters. So again, simply put, HD is simply utilizing more of that 1 second of time. Now, I can guarantee you with 100% certainty, over the next 2 to 3 years, these are really the only discussions that any of us are going to be having in the world of neuromodulation. This is certainly a hot topic in the world that we live in right now, and you're going to see some additional therapies coming to the market, additional players, and so forth and so on. And I think perhaps one way to sum it up, there are many forms of HD high density stimulation. It can be achieved through high frequency. It can be achieved through high pulse width. It can be achieved through a blending of higher than normal pulse widths and rates. But nonetheless, there are many forms, and they all work. None of us can tell you for what type of patient HD is going to work better than conventional stimulation. But it's nice to have this tool in our tool belt at this point in time. And kind of anecdotally, in our territory, one thing that I will tell you is, for your patients, we have about a 70% trial to implant ratio, meaning 7 out of 10 of your patients that we trial, it will be successful and they will get their permanent implant. And for ever since I've been here, we just kind of chalked up that 30% or so. Well, the therapy didn't work for whatever reason, but hey, we tried. It was minimally invasive when we did the best we could. Well, since we started utilizing HD stim many months ago, what we've been able to do is, of those 30% of patients that would call us during a trial and say, hey, you're covering everything and I don't like it, or you're covering everything and I'm not getting enough pain relief, we switch them to HD. We're able to salvage about 80% of those. So it is very significant. And certainly don't want to make light of that. And that's been the eye-opening thing about this, because when I first started hearing about this probably 18 months ago, I was skeptical until we started utilizing it and started seeing the overwhelming successes. And again, I can't tell you when and what type of patient HD stim is going to work better for, nor can I tell you when and what type of patient traditional stim is going to work better for. But it's nice to have both tools in your arsenal. In closing, I think that I will give you a little anecdote, a little saying. I think many of you have all heard the story that all roads lead to Rome. And during the Roman Empire, Rome was the epicenter of its empire. And as they conquered another civilization, they would build roads from that civilization into Rome. And for the more advanced civilizations, the roads were very nice. They were paved with perhaps rocks and cobblestones and so forth and so on. They were very very nice. For not quite as developed civilizations that they conquered, perhaps it was a windy road through a field and so forth and so on. But again, there would be a road from that empire into the Roman Empire. And for even more primitive civilizations, perhaps it was just a little pathway through the forest. Nonetheless, there was still a road to Rome. All roads lead to Rome. Well, over the next few months, as more players come into this market space, some people are going to try to tell you that high frequency is the way to go. That's the answer. High frequency is the panacea for spinal cord stimulation. Other people are going to tell you that burst stimulation is the panacea, and that's the only way to go. And I'm sure that there will be other players over time in this market, and they're going to tell you that this form or that form is the best road to spinal cord stimulation. And what we're going to tell you is that they all work. All of these forms work. But make no mistake, all roads lead to high density stimulation. Doesn't matter how you get there, we're all going to wind up at the same place, all of us. So I hope that clarifies a little bit. If nothing else, I hope this is perhaps a conversation starter for the meeting. Randy, Jody, Eric, and Misty are more than capable of discussing in great detail some of the finer points of HD stimulation. But again, I just kind of wanted to have a frame of reference and a starting point. And I hope that this helps, and I hope that y'all are having a great weekend. Y'all take care.